Why does the corona epidemic spread in the United States so quickly? The United States detected the first infection with the coronavirus at the end of January, and soon the infection spread to include 100,000 people on Friday. This has made this country the top country in the world in the number of casualties, amid questions and public anger over the spread of the epidemic. The death rate is still much lower than in many European countries. It does not exceed 1.5% of the number of injured, compared to 7.7% in Spain and 10% in Italy, but the death of about 1,600 people was sufficient to spread terror in the hearts of Americans. Causes of spread. Many people today wonder why the crisis in the United States has reached what it is today, and the answer may be summarized in two main points. 1. Delayed testing. At the start of the epidemic crisis, U.S. President Donald Trump was accused of downplaying its severity when he contradicted the views of health officials, and said that the spread of the virus locally is not an inevitable effective because there are no widespread examinations, as the government refused to allow states to develop their own checks, and restrictions were only lifted on February 29 when the first death occurred in the United States, more than a month after the first infection was detected. Gabor Killin, director of the Department of Emergency Medicine at Johns Hopkins University, explained that if they had been able to monitor those who had communicated with the injured, they would have isolated the major outposts. Weak federal coordination. New York State has become the epicenter of the epidemic in the United States with about 45,000 injuries and more than 500 deaths as of Friday, followed by New Jersey, California, Washington, Michigan, and Illinois. What Harvester needs to be a true national effort in coordination. Harvard University public health professor Thomas Tsai has. Each state has its own policy, causing transmission from one state to another. Experts agree that social exclusion measures are necessary to continue to reduce the spread of the epidemic, that is, to slow down the number and speed of new infections to avoid, as far as possible, the exhaustion of hospitals, as in New York. Coast Guard in Miami, Florida working with paramedics to evacuate Marine crew members who were infected with the coronavirus yesterday. Anatolia, time is a less lethal form, according to Gabor Killin, and heat and humidity may slow its spread. The University of Washington School of Medicine expects that if the current path continues, the peak of the epidemic will be in mid-April, with the death toll reaching around 80,000 from next June. The model set by the college indicates that this number will range between 38,000 deaths as a minimum and 162,000 as a maximum. By comparison, the flu has killed 34,000 people in the U.S. in 2018 to 2019.